Hey, good morning. My name is Nicholas Wright. I'm a Virginia LPC resident, also a Virginia Certified Substance Abuse Counselor. And today we're going to talk about self-care for essential COVID-19 employees and what that kind of looks like. I know a lot of times we discuss self-care for the general population, which is important as well, but this one is geared more so towards essential COVID-19 employees and stress and anxiety that they may face. All right. Essential employees. Essential employees are defined as those people healthcare who work at healthcare facilities, grocery stores, water utilities, and other work sites that engages with the general public on an everyday basis and giving them the ability to not quarantine. Also, the 49 to 62 million workers in the United States make up this demographic of essential employees. Now, self-care strategies that I'm going to discuss today, we're going to focus on the area of preparedness while you're actively working, as well as normalizing effect once it's over. Now, preparedness. It all starts with being prepared. Preparation prevents piss poor performances, right? Practice and preparation prevent piss poor performances. So when we're looking at, we want to really be prepared. So do we have our child care in place? Just in case the person who's supposed to start a shift after us doesn't show on time, or if the truck comes late, or if a crisis occurs. When does it occur? 10 minutes right before we're supposed to get off, right? That's how it always works on a Friday. So you really want to make sure you have those things in place so that you can feel at ease. Emergency bags, food, money, clothing, etc. So you don't always have to go to the vending machine. You can have some food from at home that's comforting to you. In addition to that, maybe you do want to go to the vending machine. You want to have some quarters or some dollars or whatever your vending machine takes, credit card, so that you can get those snacks that you need to stay rehydrated. And clothing from home. Sometimes switching out of the work clothes into a hoodie, or even changing out of those shoes and putting on some flip-flops. I know some people like essential oils. I heard some people like peppermint oil to help with headaches, and some people like lavender to help with stress. So having those things in that bag. Trainings. Being trained. Are your employees properly trained? Or are you up to date on the trainings that your job has provided you on the different assessment tools for how to interact with someone? Do you know your assessing questions? Do you have a fever? Have you come from or traveled to an area that the CDC recommends that we stay away from due to a lot of people having coronavirus outbreaks? If you run into that individual, do you know the strategy for how to quarantine that individual and decrease the transition of the coronavirus? Are you following the protocol when that incident occurs? Also, resting and staying hydrated, right? We all know that sleep deprivation isn't good for anyone. So you got to get your proper rest before you begin and before you go to work, and as you prepare for your next time at work, or as you begin your shift. All these different techniques and strategies will help decrease some of the stress and anxiety, because it's not if we have a situation, it's when we have a situation, we're going to be okay because we know the policy and we know that we're prepared to handle it and make those proper phone calls and contact whoever we need to continue to stay on and perform our job as essential employees. Common stresses and themes that I'm seeing among healthcare workers are stigma. Thank you for your service, but in addition to that stigma, there's another stigma, which is, people kind of giving them the side eye and being uneasy around them. We might not understand why people do the things they do, but we can reach a point of acceptance and accepting people for the things that they do in their behavior. And once we reach that, it helps us manage our stress. If we can transition from worrying about why are these people acting like this, why, to accepting people for who they are and who they present themselves to us to be, it'll help our essential employees in the long haul. A few other common themes I'm seeing is social isolation. People sending their kids and their spouses away to avoid disease transmission. People are afraid that they're going to catch it and die. Workload demands, inner conflict about competing needs and demands. Another one is PPE and irritation from the PPE. 59.6 people reported acne from wearing the N95 mask. 35.8 reported having a rash. 21.4% of the 299 who wore gloves regularly reported, having uncomfortableness, and 73.4 discussed having a skin rash, 56.3 an itch. You can read it. But basically the goal is to try to be prepared for when that situation occurs. So a simple preparedness can be knowing what gloves work for you, right? So, or using, if you're regularly washing your hands, right? Dry skin. So having non-scented lotion so it doesn't irritate the skin as much. Also, if you can, maybe use nitrile gloves or powder-free gloves to help. And if you're working in the grocery store, maybe you use cotton gloves, or just having those tools that work for you. I know also the mask, the irritation that occurs. Vaseline is good to help kind of decrease the direct contact and irritation on the face and the pressure. Band-aids on the back of the ears is another common one that healthcare professionals are doing. In addition to this one I learned about, which is the paperclip technique. So they're putting a paperclip on the straps to decrease the pressure on the ears, and it's still providing the security that they need to remain safe during this crisis, and as well as take care of themselves from abrasions and bruises from working those long hours and interacting as an essential employee. So those are some things we can do in the prep, in the front end. Now we're moving to while you're currently working or while your employees are actively interacting with the public. And what can we do? All right? Some coping skills. I can't stress this enough. The first point, mental health cannot be an afterthought in coping with the pandemic. Again, mental health cannot be an afterthought when coping with this pandemic, okay? We have to help people in the trenches where they are right now to decrease the things that are going to occur afterwards. So we're looking at, I know UNC Chapel Hill, University of California, San Francisco, they've been implementing psychiatric services. They've been connecting with local essential employee organizations and finding where those essential employees are working, grocery stores, UPS, FedEx, all these different organizations, to bring to them the ability to an outlet for their employees, whether that's therapy services, psychiatric services, even telehealth, just an opportunity for people to discuss and dialogue, even peer-to-peer supervision. Self-monitoring and pacing, journaling, regular check-ins with your colleagues, families, and friends, peer consultation and supervision, and separating anxiety from actual threats, and taking time out for body care and refreshments. Now, in the same breath, we also want to avoid a few things. And some of those things include negative coping skills, drinking too much, increase in smoking. You want to watch yourself and be able to self-analyze so you can reflect accordingly and react accordingly. Working too long in isolation without checking in with colleagues. Yeah, it's good to check in with your colleagues for them, but you also is good for you. You know, sometimes we turn into worker bees, as they say, and we get into this groove and we just start working by ourselves. But sometimes we got to take a step back and reflect on ourselves. And we also got to watch this thing called compassion fatigue. It's one of those things where you feel like you're not doing enough, or you're just working around the clock. I want to help. I want to help. I want to help. I understand a lot of essential employees are nurturers by nature, but you really have to take some self-care. And watch how much intake you're taking on coronavirus information. Sometimes it's good to take an hour, 15 minutes, even if you can just take 5 minutes while you're currently at work to take a step back and breathe, you know? And just no cell phone, no coronavirus news, nothing related to a coronavirus patient, you know, and just take 5 minutes to yourself. Take that 15-minute break, okay? Now, DBT tips. Dialectical behavioral therapy. It's a technique we use to help change people's mind frame, change their thought process, right? So if someone's ramped up and they're anxious and they're having a panic attack, or they're in the middle of an anxiety, heightened anxiety, these are some quick tools that might help them. Ice. Give them some ice or cold water. So if we can change their body temperature, hopefully we can change their thought process and regulation. Intense exercise. Running the steps to the point where you get tired and fatigued, so you're no longer thinking about that thing that caused you the anxiousness. Paced breathing, 5-7-5. Breathe in for 5 through your nose, out your mouth for 7. In your nose for 5, Out your mouth for 7. 2 key things. You want to try to make sure your shoulders don't move too much. You want to really have it from the diaphragm. You want to have diaphragm breathing. And you also want to make sure your exhales are longer than your inhales. And another technique is paired muscle relaxation. That's tensing of the muscles. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Now relax. Whew. My fingers feel loose already. Tensing of the muscles. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Slowly relax. Whew. It just loosens up those muscles and hopefully can bring down that anxiety. A couple techniques to try for those people who are already revved up and already feeling that heightened emotion. Another thing is separating normal anxiety from actual threats. Hey, I go get lunch with some friends in New York City I haven't seen in a long time. In the taxi cab ride there, I start to feel shortness of breath. I start to sweat a little bit. You know what? That's normal anxiety. Yes, some anxiety is normal. But I'm walking down the street in New York City and I see a tiger loose. Now that is a fear. That is something that I should be worried about. That's an actual threat and an actual danger. So we want to separate the difference between normal anxiety and an actual threat. And here's a chart that I saw in another presentation from psychologytools.com, and I thought I would share with you guys. The worry chain. Hey, I got a headache. What if it is coronavirus? Maybe I passed it on to everyone at work yesterday. Everyone will pass it on and die. Imagining an apocalypse and losing everyone who I know and love. We call that catastrophic thinking. You know, at this point in time, you revved up your mindset to a point where you're anxious, you know, you're kind of manic, rapid thoughts. So you want to take a deep breath and be able to identify when your body is beginning to have those thoughts and when your body is beginning to ramp up so you can decrease those things and those worries and perform more productively. All right, normalizing effect, right? This is the last section. So we're in the beginning, you know, we've made a plan. Okay, now we're implementing our plan at the workplace and we're handling it. And now we're getting to the end, which is the normalizing, you know, getting back to the way things used to be. And that's going to take effort for people who are essential employees in the field. So we want to help them as they begin to try to work through these barriers and these issues they have. All right, social support. Again, it's time. It shouldn't be called social distancing. It should be called physical distancing, but that's another PowerPoint for another day. I encourage you to socialize, even introverts and extroverts. You know, even the introverts require a certain level of social interaction to fulfill their need for the day to manage. So engage with those people, whether it's telehealth, whether it's face-to-face, or even just a telephone call. You need that social interaction. Vacation time. Take some time for yourself. All right, essential employees. I know you guys are doing a lot, whether it's loading the trucks, whether it's working with the patients. Don't forget, when this is over, take some time for yourself, even if it's just to catch up on some daytime TV and take a long soak, take a nice hot bath. You know, one-on-one counseling is a good one. Counseling. The ability to go somewhere and say whatever you want for an hour and not have to worry about it coming and bothering you in your everyday life is so relaxing and gratifying in a way that is like no other. And I encourage everyone to try it while the opportunities present themselves if you haven't done it before. And if you have already engaged, make another appointment so you can stay up to date with your therapist and you guys can continue to have that dialogue and you have that safe space to vent and discuss different barriers that might be impacting you, or just to, again, vent and get some things off your chest. And also encourage journaling, right? Journaling is a great technique because journaling will allow you to put down your feelings and emotions and allow it to be true to you and have that space for expression. Exercising, comedy, meaningful activities. Me, I like cooking. I'm not the best, but I like to do cooking or vlog videos with my kids. So I encourage you guys to find some meaningful activities that provide that normalization again. Bowling, you know, once the opportunity presents itself, I encourage you to, you know, can just push. I know it might not always feel the most comfortable, but give it a shot and just try to engage in the community once again. Here's some of the references I have. If you have any more questions, feel free to contact me, wrightfoundation.ceo@gmail.com, or leave a comment below if you have anything else you want to touch to. And keep in mind, this information is always changing and evolving, but this is what we have today. And what I can do is present what I have. and I want to help. And if there's any way I can, just let me know. I can present